Warning, listening to this show may result in increased levels of inspiration, motivation, and innovation. Side effects can include the immediate urge to take massive action to build a better business and life for yourself and others. You've been warned. Welcome to Influencers Radio with your host, Jack Mize.
The information presented in this episode is not intended as a substitute for the medical advice of physicians. The listener should consult a physician in matters relating to his or her health and before making any changes to prescribed medications or procedures. And welcome back to another episode of Influencers Radio. According to the American Academy of Pain Medicine, more Americans suffer from pain than heart disease, cancer, and diabetes combined. That's 100 million people, making it one of the most complex and troublesome health problems of our time. Well, my guest today is one of the world's leading experts in physical medicine and pain relief. He's an award-winning chiropractic physician and a champion of evidence-based and patient-centered healthcare with a long track record of helping people eliminate pain and regain their health by integrating the best of the holistic and medical worlds. He's also the author of the new book, The Solution to Back and Neck Pain That No One Is Telling You About. It's my privilege to have him here today to tell us about it. Please welcome Dr. Ben Grams. Welcome to the show, Ben.
Hey, thanks, Jack. Thanks for the generous introduction there.
Well, you're welcome. And I'm sure like just about anyone that's listening either knows someone or experiences some level of pain themselves. So what I want to do is start out by defining the type of pain that we're talking about. This isn't about being sore. This is about folks that are experiencing, I guess, what we'd call life-altering pain, which really limits the ability to live and to live their life to a full capacity, right?
Right. You know, and really, it's not the type of pain that you stub your toe and then it goes away. It's not what we're talking. We're talking about chronic pain. And technically, chronic pain is defined as pain that's been around for 3 months or more. That's a technical definition, but even that doesn't do it near the justice that really what pain, like what you said, is life-altering. I mean, it's been shown that people who are suffering from chronic back and neck pain, they do less, they're less productive at work, they earn less. In fact, last year, Americans spent more money on pain and lost more money because of pain than the economy of Denmark is even able to generate in a year. It's like $11,000 per second Americans are spending on back and neck pain. And it's even being shown that people in chronic pain are more likely to be depressed. They are more likely to be overweight. The European Journal of Pain just came out with a study last week I ran across that said that people who suffer from back pain have a significantly higher chance of dying sooner than those with non-back pain. And so it's just not what pain is, it's how pain actually interferes with life. And, you know, you're right that heart disease, cancer, and diabetes are the leading killers of Americans, but chronic pain is the leading killer of Americans' quality of life.
Yeah, well, and I think everyone, like I said, can see evidence of that either through themselves or through, friends, family, loved ones. So let's start off. I want to talk about in your book, the solution to back and neck pain that no one is telling you about. You outline and expose really some of the most common myths that are preventing a lot of folks from understanding the real options that are available to them. So I want to cover a couple of those. So let's start with what I think is one of the more dangerous misconceptions, and that is, they make a pill for that, don't they? That seems to be the answer that people turn to.
I think we have to start with asking the question is, why has that become our default? And so first things first, one thing that I think people are starting to become more aware of, but especially pain sufferers need to be acutely aware of, is the sway that the pharmaceutical industry has around healthcare. Like the British Medical Journal reported that Big Pharma spends 19 times more money on marketing than they do on development and research, which means that they're spending 19 times more money on convincing you and me to take whatever it is instead of improving their own medication. And so when it comes to pain, that's what they want us to believe, that, hey, all you have to do is take this pill and the pain will go away. You know, they frame pain as an inconvenience when really it's far from it. And so I just want to point out one of the fundamental flaws because pain medication can provide pain relief, but it never will be able to provide a pain solution. And this is what I mean. Jack, just play along with me. Let's say you go home and you see that your faucet has been left on and there's water all over the floor. Okay. What do you do?
Well, you try to find the source of the leak.
Right, and then you have to mop up the floor, right?
Yeah.
And that's where pain medications come in. Pain medications are helpful in cleaning up the mess of pain. So pain is a symptom, just like the water on the floor is a symptom of the leaky faucet. But the medication can never, ever, and will never be able to fix the underlying problem with the spine that's causing the pain. And the problem with that is that if that underlying issue isn't addressed, as soon as you're off the pain medication, it comes back, which then you start falling into this pretty steep hill of side effects. Because consider this, acetaminophen, which is found in Tylenol and Excedrin, they are the deadliest over-the-counter painkiller that's available. In fact, it's our nation's leading cause of acute liver failure. It sends about 78,000 Americans to the ER every year. That's acetaminophen found in Tylenol. Or then you have like the non-steroidal anti-inflammatory drugs like ibuprofen, which is found in Advil, Aleve. And so according to the New England Journal of Medicine, these medications cause nearly 16,500 Americans to bleed to death every year. It's the 15th leading cause of death in the United States. And these are just the medications you and I can get from going to the gas station. And then if you take and you pile on top of that prescription pain medications, which they're even more effective, but they're even more dangerous, that's one of the biggest myths out there. And so, like, I just want to make one thing clear, that there is absolutely a time and place for pain medication, without a doubt. But it's one thing to give pain medications or painkillers to a dying 85-year-old than it is giving pain medications to a chronic pain sufferer and telling them that they're going to have to depend on these dailies for the rest of their life.
I mean, that really is, it's staggering. Those are staggering facts about, how dangerous that medication is, that doesn't require a prescription, that is something that we could just go grab at the store. And probably everyone listening is familiar with the medications that you just talked about. And they probably have them in their house somewhere, and they probably give them to their kids, their family, thinking this is what we should do. That this is how we fix the pain, and that we have a reason for experiencing pain. So what is that? Why is pain necessary? Why do we even have pain?
The best way I can illustrate this is through just a small story. Back before the times of modern technology, miners, one of the biggest risks miners would face would be carbon monoxide poisoning. And the thing with carbon monoxide, I'm sure you know, and the listeners know, is that it's odorless, it's tasteless, can't see it, but it's deadly. And so your next breath could be your last. And that was a real problem in the mines when they're mining coal, because carbon monoxide poisoning forms from the incomplete combustion of a fuel. So if they're using dynamite to, blow out mining pits and things like that, this stuff can form. And so what they would end up doing is that they bring canaries down into the mine with them. So if the canary and canaries are highly sensitive to toxic gases. So if the canary would ever stop chirping or would just drop dead, the miners knew that they would have to stop what they're doing, change direction, and run for their lives. And that's the purpose of pain. No matter what the media or big pharma frames pain as an inconvenience, it's not. Pain is a warning signal from the body to the brain, alerting us of danger, that something's wrong.
I haven't been able to read the label of a bottle of aspirin, Tylenol, you name it. Right? It's so small. They may warn you all, in 3 paragraphs that don't take this, you'll die, but I can't read it. Right. And you talk about the marketing. We see pain medication marketing or just plain pharmaceutical marketing, every day, every hour. And they all seem to have that magic bullet. And you even talk about in your book, I think it's myth number 7. The chapter is called The Magic Bullet. And a lot of pain relief solutions market themselves as that instant relief. And even though they might be able to instantly mask that pain, besides it just, masking the symptom rather than being a solution, it also creates this expectation. Unfortunately, there's people that are starting to have that expectation that in order for pain relief to be a real option or to, consider it any good, it has to work immediately. Do you see that as a problem?
Oh, it's for sure. It's one of the biggest pitfalls I see chronic pain sufferers who are coming into my clinic dealing with on a daily basis, without a doubt. But I think it's important to recognize that this urge to get out of pain immediately is actually hardwired into our nervous system. We have reflexes for this. If you're stepping on a nail, your immediate reflex is to get the weight off that foot. Your body does it automatically. Or if you're touching a hot surface, it's automatic. And so this is, and then, and they're clever, the marketing guys, they figure out how to leverage this, but you're right, it's created an environment where people don't have realistic expectations, especially with chronic back and neck pain, as far as the healing process. So this urgency has really become the enemy for creating long-lasting pain relief, because curing chronic back pain and neck pain, it takes time. And during that time, there's a lot of ups and downs and there's plateaus. But there's no way to get around that time side, because it's part of the healing process. That's the way that the body goes. And so if a person's dealing with chronic back and neck pain and they're looking for an actual solution, going into whatever intervention they're going to do, going into that with eyes wide open, knowing of the actual time frame, that's a crucial piece.
One of the things, and that I have great respect for you, is that you're very realistic and you're not afraid to be realistic. And I know we talk about we use the term eliminate pain, but sometimes the best solution obviously may not be the total elimination of pain. But I'd be willing to guess that for a lot of folks out there, their benchmark for success, what they really want is not necessarily even if pain is eliminated, but they just want to feel better. Do you, see that type of situation a lot?
Oh, yeah. And that's just it. It's getting pain relieved for pain relieved's sake doesn't really do anyone any good. It's when the pain is interfering with, you not being able to pick up your kids or grandkids. Now that's what has to get focused on. Or if you can't go for a walk, or you can't walk 5 blocks without pain, or you can't sit for more than 15 minutes without this back pain showing up. It's what the pain is actually interfering with. That's what has to get cleaned up. That's what has to get fixed.
How can someone who is experiencing chronic pain and, they let's say they don't want to take the pain medication for the rest of their lives, but they just want to feel better. How can they achieve that when, the answer is constantly being fed to us that here, take this pill, this is what you need to do?
The first step is, if you're dealing with chronic back and neck pain, do not lose hope. Do not lose hope. Because if you don't believe you can get better, you're not going to do what's necessary to get better. And I think that's a crucial part. I mean, even I've had patients come to me after being consulted with another healthcare professional, and they say, well, they just told me I have to learn to live with it. Really what they're saying is that you're going to have to learn to live with this thing until you die. I mean, there's nothing better. They can't get any better. And it's not true. That's number one. Don't lose hope. Number 2 is to understand a basic concept when it comes to the back and neck. And this is it. Your back and neck will be as pain-free as possible when they are as healthy as possible. And so let's just really clearly define what is healthy, what is health. If you look up a medical dictionary, health is defined as the state of optimal function. So if we back this up, to be as pain-free as possible, you have to be as healthy as possible, which means that your neck and back have to function optimally. So what does it take for the neck and back to function optimally? Here it is. The joints have to move well, and the muscles need to be strong and coordinated. If you can get the joints moving better and get the muscles strong and coordinated to protect the spine, it will function better, which will be healthier. Then you'll experience less pain. So that's number 2. Number 1, don't lose hope. Number 2, understand that basic concept. But number 3 is that you have to get the right kind of help. And if the listener is someone who has been dealing with pain for a long time, or someone who's just considering starting to get help, this is huge. You have to start out on the right foot. And really what the person needs to be seeking out is a non-drug, non-surgical person who has extensive training in physical rehab and who is a back and neck pain specialist. And you'll know that you're in the right place if that person's doing four main things. Number one, they need to be able to identify what it is you're doing wrong. Because the chances are, if you're suffering from chronic back and neck pain, you're probably doing something on a daily basis that's hurting the neck and back. And in fact, this is the faucet. This is the leaky faucet, is that we have to identify what that is and stop it. Because if you keep making that mistake with the back, it's going to keep going down that same direction of generating more pain. That's number one. Identify what you're doing wrong. Number two, this person or this clinic, whatever it is, they need to be performing spinal adjustments. There's a basic rule of the spine is that it cannot heal if it cannot move. And spinal adjustments are the most effective therapy in getting dysfunctional, stuck joints moving again. It's the best one. So that's number one. Number two. Number three, there's four pieces. So this is number three, hands-on muscle therapy. I have not met a chronic pain sufferer who hasn't told me, I got tight, sore muscles that they're knotted. Everyone points to their upper back or neck. And so the thing is that those muscle knots, that's actually scar tissue adhesions, and that stuff has to get broken up. So that's number three, hands-on muscle therapy. And number four, this is the last one, there are small muscles that surround the spine. Their only job is to stabilize it. Now, these aren't the muscles you can see when you look at a person's back. These are deep spinal muscles. And these are one of the most overlooked aspects to relieving chronic back and neck pain. Because in the presence of pain, or if joints don't move well in the spine, these tiny little muscles, they get shut off like a light switch, and they can become pathetically weak very quickly. And if they're not turned back on and strengthened very specifically through a method and a protocol, they'll stay weak, which means the spine won't function right, and the pain will just keep coming back.
One thing I think we probably should address is that when people have been seeing a doctor, they've sought solutions, and maybe they're at that point that this is something they just have to live with. That the doctors that they've been talking to aren't necessarily bad people, right? They're not trying to cause them harm, but one of the things you talk about in the book is they don't always know best. And you mentioned just a moment ago that the physical medicine may be overlooked or completely ignored. And you talked about how to recognize this, but how do you recognize where that maybe there is a solution beyond what I'm being told? Not that they're trying to hide anything from you, but just to say, you know what, maybe I should continue to look beyond this.
In fact, in putting that book together, what I've found out about this topic, chronic pain, and the doctor side of it was like a gut shot to me, because it exposed some real problems in the way that chronic pain is being addressed at a fundamental level within healthcare. Judy Foreman, author of the book, A Nation in Pain, said that pain is the main reason why people go to doctors, and yet most doctors know almost nothing about it. In the research article you referenced at the very top of the interview about heart disease, cancer, diabetes, later in that same article, they talk about this. They say, our concern is that too many physicians harbor outmoded and unscientific attitudes toward pain and people in pain. And so now these folks, they know the research a lot better than I do. And when they make such bold comments as this, it's a reason for real concern. And so how can it be that pain is the main reason people go to doctors, yet most doctors know almost nothing about it? An article in the Journal of Pain, 2011, said that a large number of U.S. medical schools don't report teaching any pain in their curriculum. And even the better schools that were investigated, they report teaching about 9 hours about pain. Now, this isn't 9 hours a semester or 9 hours a year. This is 9 hours over 4 years of medical school. And I'm certainly not throwing my medical brethren under the bus with this, because chiropractic, physical therapy, massage therapy, acupuncture. All of these healthcare fields they're just some severe deficiencies in the basic education with it, and which has led to the problem with treatment that's at our doorstep right now. There's a well-respected, internationally respected doctor. His name is Gordon Waddell. And I mean, this guy's written textbooks on back pain. And what he said is, it's shocking. He said that the treatment you get for back pain depends more on who you go see than what's actually wrong with your back. And the reason why he's saying that is that each healthcare profession has developed this lens. So I'm a chiropractic physician, so my lens, if I'm not aware of it, is this person a good chiropractic patient or not? Or you go to a surgeon, is this person a surgical candidate or not? And so it becomes more about the physician's skill set than the patient's needs. And so when I talked about that myth that the doctor doesn't know best, in the vast majority of cases with healthcare, it's absolutely true. Doctors knows best. Follow your doctor's orders. But when it comes to pain, we have to take a step back and recognize the status of the environment, which is why getting the right kind of help, that's a crucial part of getting a chronic pain sufferer some long-lasting relief.
You know, I did bring up at the top of the show also that you're known for and highly regarded as someone who is integrating the best of holistic and the medical worlds. Really mean that you don't necessarily neglect or say to ignore either side of them. You're not excluding either side of that. Now, when I say the best of holistic and medical worlds, there's also a not so best of those worlds, right? And so is there anything that people should watch out for when they're dealing with non-traditional, medical solutions, the people that advertise as holistic solutions? If they go to someone, there might be start lighting candles and flinging smoke around or something like that. There's an extreme, right? When we're defining holistic, what should people look at to make sure that there's some evidence base behind what they're being told?
That's a great point, because there are two sides of the coin. Absolutely. I think number one is, and we touched base on this earlier, is knowing what the realistic expectations are. If you go in somewhere and the person in front of you is saying, we can get this, let's say you've had pain for about a year, we can get this gone in a couple days, that's a problem. Or, drink this juice or apply this oil or attach this mechanism to your knee and it's going to provide instant relief. Just knowing that the time frame is important. That's a true testament. The research is very clear on what is a realistic time frame for pain relief if the right care is being given. So that's number one. But number two is that if those four elements I talked about, they have to be hit. You got to figure out what you're doing wrong. Whether you're sleeping in a weird position, you have bad lifting mechanics, your neck is being held in a misaligned position over the shoulders. Whatever it is you're doing wrong has to be figured out and fixed. The spinal joints have to get moving better, so you have to be adjusted. The scar tissued muscles need to be taken care of with hands-on muscle therapy, and the weak muscles need to be strengthened. If those four elements are being hit, my opinion is that I don't really care if the person's waving smoke and wearing a mask, or they're wearing a stethoscope and wearing a white jacket. If those four elements are being hit, they're doing what the research has proven to be the absolute most effective care, the best protocol for chronic back and neck pain.
Well, you certainly have a passion around what you're doing, and the fact that what you're doing and what you're telling us is based on science, right? It's based on evidence, even based on the American Academy of Pain Medicine, which is from the data that we brought up.
But there's even two sides to that evidence coin too, and it's true that we have to have some type of validified research that is guiding us on treatment protocols. Absolutely. But even the world of research is, in some cases, isn't as dependable as what we're led to believe. And I think even the foundation underneath that evidence base is common sense. It's common sense. Like, let me give you an example. If there's a plant and we give one plant, and the plant is withering, and we give one plant real water and then the other plant fake water, but then at the end of that study, we see that the withering hasn't changed at all, the author could say, well, watering this withering plant didn't help it. So anyone who'd recommend water to a plant is an unscientific quack. So, but that doesn't make sense. You ask any grade school child, does a plant need water? Everyone knows yes, a plant needs water. And so when it comes to chronic back and neck pain, once again, it falls back to that very basic understanding of, in order for the spine to be as pain-free as possible, it has to be healthy as possible. That's the foundation. But then the question is, what evidence is available to us that shows us what treatment gets us that result then?
Yeah, and I think even without looking at the data, people can just use common sense and look around them. I think a lot of people have experienced, or really when it comes to pain medication, you could probably pick any year and look at that year in review of celebrity deaths, and I don't think that you could find a year where there's not at least one, but generally more, that pain medication wasn't involved in someone's death. And I think that right there is, speaks volumes to the fact that there's a problem with this.
Oh, for sure. And, there's even, so that's pain medication, but even take like spinal surgeries. Waddell, once again, in one of his textbooks, said that spinal surgery has been accused of causing more human wreckage than any other procedure ever. And so, you're absolutely right. Pain medications causing this, spinal surgeries, especially the fusions that used to be done decades ago. These were disabling people. And so you're right. Looking around at like your peer group and your community, what therapies are people getting good results with, what are not?
What is it? And your passion is clear, just listening to you speak about this. What is it that inspired you to get into this, to help the people that you're helping, in particular to write this book?
Last Friday, I was asked to give a talk to a local, they're like juniors and seniors in high school, and I was asked this question, and I had to hold back tears, so I hope I can do that now, because there's one defining moment that set me up on this course, and I remember it vividly. I was, 16, 17, 18, somewhere in there, and my grandma she was living with us, and she kept saying that she's so tired. And it wasn't a normal type of tired, Jack. It was a deep in her bones tired, like she would sleep throughout the day. And this wasn't her. She was a feisty Norwegian. Like she'd be, when she was feeling well, she'd be making lefse and lutefisk and sugar cookies. And she's always doing something, but that changed. And so we knew something wasn't right. We brought her into Mayo Clinic. I grew up in a town by Rochester, Minnesota, where Mayo is. And that was on a Sunday. Monday, she's laying in the hospital bed, and suddenly there's these screams of agony. And my mom was down the hall, and she said she could hear these screams from my grandma. She turned the corner coming back in the room and saw that it took the full strength of two male nurses to hold down my tiny 82-year-old grandma at that time because of the pain. And, they drugged her, they got their pain down. And what had happened was that the lining of her stomach had burst. It's called a perforated ulcer, and it's incredibly painful. It's one of the most painful things, and it's life-threatening, but they're already in the hospital, so they did emergency procedures, got her life saved, got her stable. The family asked the doctor, like, where did this come from? How does the stomach just burst like that? And he said it was likely due for two things. One, she was on a very powerful osteoporosis medication that was known to have hard effects on the gut. But number two, she was taking ibuprofen, nonsteroidal anti-inflammatories consistently for her aches and pains. And the combination of those two things, he said, were at least likely to contribute to the perforated ulcer. At that point in my mind, it was like being struck by lightning, and that I decided that I was going to help people get as pain-free as possible, but do it without medication. That's just going to be my way I was going to go about doing it. So then that was, almost a decade and a half ago, and here I am now.
I want to thank you for sharing that, and it's one of the reasons I consider you an influencer in what you do, because And I mentioned it earlier that it's not just about the people suffering from the pain. What you're doing is also affecting the lives of their loved ones, their friends, just like it affected you with your grandmother. It really is a remarkable story, and I want to thank you for sharing that background as well. How can folks find out more about Dr. Ben Grams and also how to get a copy of your book?
And that email address is drbengrams@gmail.com.
Well, Dr. Grams, I think what you're doing is one of the most reasonable and logical approaches that, is really giving people real hope, a real solution, and real relief from their pain they're experiencing. And I want to thank you so much for coming on today and sharing this information with folks. You've been more than generous with this information, and I think it's probably opened up a lot of options for people that thought that they were just at the end of their journey to the solution. But there is a way to at least feel better. So thank you so much for coming on and sharing that.
Jack, I appreciate the opportunity to do just that, and I hope that someone who's listening to this, from what they learned, just deals with a little less pain and they can enjoy life a little bit more. That's the goal. Remarkable.
Folks, there you have it. Check out Dr. Grams' book, The Solution to Back and Neck Pain That No One Is Telling You About. We'll have the links along with the links to his website and social media profiles as well on the show post. And until next time on Influencers Radio, remember, you are the only real game changer.
You've been listening to Influencers Radio. To get all past shows and updates on future shows, visit influencersradio.com today or follow us on Facebook at facebook.com/influencersradio.